Hi everyone, I'm Rosemary Pharo, one of the founders of Reiki Medicare. We thought it was a good time for the four of us behind the project. That's Feona Gray. Hi Fiona.
Hiya.
Diana Shaw. Hi Diana.
Hi.
Alexander Gray.
Hello.
To give a quick update of where we are, why we think the project is important, and something that will be here for a long time, and the different ways in which people involved in Reiki can help. So our idea is really to support the well-being of hospital doctors, nurses, midwives, paramedics with a free, confidential and easy-to-use service that provides distant Reiki from our amazing volunteer teams. Alexander, perhaps you can say a little bit more about the protocol we're using.
Yeah, sure. So as one of the practitioner members, I'll be providing 4 20-minute Reiki treatments over consecutive days. The recipients choose the day and time that suits them when they're off duty. Once signed up, we then send them guidance on how to make the most of the treatments. The treatments can be repeated, they just need to ask for a bit more. All we encourage in return is that recipients fill in a MindMop based evaluation form to measure before and after levels of stress, anxiety, sleep, pain and well-being. MindMop, for those that don't know, is the same kind of questionnaire that doctors and medical researchers use to check if treatments are having an impact. This all then goes into a database and is evaluated as data gathering for research purposes. Our research partner for this project is Dr. Anne Baldwin, PhD, who is a research professor of physiology at Arizona University.
That's brilliant. We're so lucky to have her, and thanks, Alexander. Fiona, you had the first idea for a service like this last year.
Yes, indeed. It all came about from a conversation with a matron at St George's Hospital in London. We have a pioneering project there for patients, and the matron, or a matron, recognised how the energy shifts on the ward when Reiki practitioners are around, and wanted her staff to benefit, but they just don't have time. They have no time on shift. I've seen over many years how Reiki practitioners and communities around the world have been banging quite hard at the door of medicine to be let in. And since I've been involved with the Connecting Reiki with Medicine program, I've come to realize that there's another way. As a community, what we need to do is to just let Reiki itself do the work. And the comment from the matron somewhat, I think, illustrates this really well. So now is the time to build bridges and build connections between medical professionals, researchers and practitioners to support and learn from each other. At least that's what I see. And I think it's a win-win outcome. Ultimately, everyone will benefit.
Yes, I agree. I think that's absolutely right. And for me, this is a very logical and crucial next step after our Connecting Reiki with Medicine project. And in that project, we have a Reiki service integrated into some of the most complex medical wards at a large London teaching hospital. And the Reiki and medical communities can use what we've learned already there as a model for other hospitals and medical centers. Now, with this project, we have a wonderful new opportunity to treat the hard-pressed staff who've been working all hours to save lives during the biggest pandemic in 100 years. And I know also that many of us really want to help during coronavirus. And Reiki Medicare gives us that chance in our own hands. And even if we're self-isolating, even if we're suffering ourselves, we can give back to the people who are saving lives. And I think this will all become a memory. COVID-19 will be a memory. But by that time, we will have proven the difference Reiki can make, both the doctors, nurses, and paramedics who get it directly and through our research results. And it will help make Reiki in hospitals truly accepted and valued for the future. I keep hearing people saying how the world will be different after coronavirus, and let's make this one of the ways.
Yeah, absolutely. And I think it's because one of the key things that we have done, and I really don't think it's ever been done before, is to build a system that's fairly automated and that can actually be adapted in the future to suit healthcare systems around the world. Crucially, I think as Alexander mentioned, it's got the ability to gather and analyse data for future research purposes in an inbuilt database behind the website. And this is very special because there is no useful research on the efficacy of distant Reiki. I mean, can you just imagine how the world could open up for Reiki with solid, effective research into distant Reiki? What a game changer this could be, and how we could reach places and people we could never reach before.
Yeah. And the way I see it right now, we're planting a seed that will grow and will spread. Like we know, if you plant an acorn, it will become an oak tree. But how tall and how wide it grows is up to the people who water and care for it. And we can't predict what will happen. I mean, maybe it will be home to lots of birds. Maybe someone will build a tree house. Maybe it will give shade on a hot day. If we band together now to make sure it's nurtured well from the start, it will be strong and healthy.
And also at the time of recording this, I think it's important to say we're still waiting for Companies House, which itself has been hit really hard by the pandemic to give us the go-ahead that we need. And it is really frustrating because we've already got over 200 verified and, I have to say, excited practitioners, thanks to all the Reiki Council member organisations who are supporting Reiki Medicare. And we believe that this number will grow significantly. And we would like to say a big thank you to the Reiki Council organisations for verifying and for being our gatekeepers, both now and in the future years to come. And I do feel it's a partnership that I believe strengthens and positions our Reiki Council members as organisations that support the medical profession and put them in the forefront in the UK.
Yeah, and there are a number of ways we can be involved, or ways to be involved as a partner. And I do see partnership as being crucial. Any Reiki 2 practitioner with more than a year's experience of distant Reiki is welcome to apply, so long as they're a member of a Reiki Council organisation. We need this because we need that they have signed up to the Code of Ethics, for instance, that they have been initiated in person, and that they have insurance in place. We have people who have applied who have never been members of a Reiki organisation for whatever reasons. Clearly, there's a vast untapped resource out there, and we're going to need more and more practitioners. It's totally okay if they don't practice Reiki professionally. They don't have to. For instance, they may be retired, and they may have a wealth of experience, that they've gathered over a lifetime of work. So we will be pointing everyone who wants to be a part of this towards Reiki Council organisations. We also need people who will raise the profile of the project for public funding and donations. At the moment, seed funding for the infrastructure we've built has come from individuals. This needs to be balanced in a true spirit of partnership and exchange, I think. So we're asking for seed funding as a one-time contribution. If you have corporate contacts, whoever's watching this, who would like to be involved, please put us in touch. All significant donors will be recognised on the website.
Yeah, and also we would be grateful to those who are ready to put UK medical professionals in contact with us, or management staff, or others who can help put Reiki Medicare into the wellness hubs. This will be crucial for our oak tree to make it really last.
Yeah, and it would be great to have some help on the sort of administration side as well. If you can't get involved as a practitioner, that would like to help in this way, we'd love to hear from you.
Absolutely, yeah. So I think if we sum up, we'd really like to say thank you to everyone who's volunteered, shown interest, supported us so far. We are creating something with very strong roots. It needs nurturing in many ways, and it is already rooted within the Reiki community, which by its involvement in what we're creating will also, we believe, grow stronger and root itself in the consciousness of our health service. Thank you.